studies are showing that diabetes is not an incurable disease. This study shows that those patients suffering from diabetes type 2, which is over 90% of them, can overcome their diabetes if they are able to appropriately modify their lifestyle. Type 2 diabetes is a lifestyle disease. This is why medicines cannot cure diabetes, but only control it. Even if one dose of medicine or insulin is not taken, the glucose levels will rise. Yet, if the patient is ready to correct lifestyle, even if they have failed to overcome diabetes by taking medication and insulin for 10 or 20 years or more, and may be suffering from high glucose levels, medicine side effects, and associated heart disease, kidney disease, retinopathy, neuropathy, non-healing ulcers, etc., it is possible to control blood sugar levels without medicine and repair and regain the health of damaged organs to varying extents. We will learn what diabetic patients should know if they want to overcome diabetes. We shall try to understand how lifestyle corrections benefit those with the high glucose and insulin levels which have damaged their blood vessels, nerves, heart, kidney, liver, sight, hearing, etc. Is it possible to regain the health of organs that have been damaged by diabetes? Health tips are not the focus here. Rather, the effort is on providing information that will help to understand the causative factors behind the health condition, measures for early detection, tests to assess the current status of the disease condition, present treatment options in modern medicine with the benefits and limitations. Also, I will try to convey the fundamental relationship of this health condition with the lifestyle and impact of correction of lifestyle has on reversing and preventing recurrence of this health condition. This is why the video may appear long. To help you save time, we have time-stamped the topics in the description below for those who prefer it. Here the focus is on those who would like to make more informed decisions on matters concerning their health. This is important, especially when they would like to avoid surgery and chronic medication with the added effort from their part. It should be remembered that those who are on medication should reduce or stop medicine only under medical supervision. If a patient wants to overcome from diabetes, first the person should know what type of diabetes he or she is having. There are broadly saying there are two types of diabetes. One is type 1 diabetes and the other is type 2 diabetes. Type 1 means there is not enough insulin. The insulin pancreas is destroyed. It can be because of an autoimmune disease or because of some surgery the pancreas is removed, something like that. There is not enough insulin is produced by the body. The type 2, that is only 10%, less than 10% is only comes under type 1 diabetes. The type 2 diabetes is the usually found diabetes, that is the adult onset diabetes, and also which is seen in the pregnant ladies, that is type 2 diabetes. In that, there is no deficiency of insulin. Actually, in most of the patients, there will be the insulin level will be high, especially even before the type 2 diabetes starts. That means we take it diabetes only when the blood sugars start rising. Before itself, usually the insulin level will start rising. Actually, in that the insulin is not working. So when the insulin is not working, body and the glucose is a high level of glucose, the body will start producing more insulin. The pancreas, the body will push the pancreas to make more insulin because the glucose level is high. Only after some time, when the pancreas is not able to make insulin sufficient, or even with the high amount of insulin which is produced by the pancreas, again if it fails, then the glucose starts rising. So that is what we have to understand. What is the here in the type 1 there is insulin deficiency. Type 2, it can be a normal insulin level, or it can be a high insulin level. That the reason is along with that there will be dyslipidemia and fatty liver. So it is actually some problem with the it will be affecting the liver, and when the liver is affected, it is not able to remove the glucose. There will be fat deposit in the liver will be there, and also dyslipidemia, excess fat in the blood also. The triglyceride and cholesterol also will be increasing. So it all goes actually parallel. Next, when we come to the diagnosis, how can we, if you are suspecting diabetes, how do you diagnose? So the family, father and mother, someone is of diabetes, there is any chance for getting diabetes? There also, the blood sugar level, sugar level is always changing. It depends on what you eat and how active, physical activity. So to know the insulin resistance level and how the pancreas is working, you should check the insulin level. And also if you are taking insulin already, you are on insulin injection, then to understand how much insulin your pancreas is making, you should check C-peptide level. From that, if the C-peptide level is low, then that means there is a possible chances type 1. If it is too low, it is almost negligible, then definitely it is type 1. But if it is only low normal or just dipped, usually it will be around 1.2 C-peptide is okay. That is the low normal level. And then if it is only 0.8 or 0.7 is there, then also there will be a chance for you can revive the pancreas if you do the correct lifestyle modification and give enough nutrition for the pancreas, do the certain exercise which can stimulate the beta cells of the pancreas to divide and multiply it, and so that they can. So that is also possible. So you should, if you are suspecting diabetes, all the diabetes patients should definitely look what is the insulin level and is the C-peptide level, and also HbA1c. HbA1c is the average of the 3 months the blood sugar level. That is what we are taking normally. Actually, it is the HbA1c level is the percentage of cells damaged due to hyperglycemia, or 5.5% glycosylation. That is acceptable level. But if the glycosylation level of the cells is 15%, 14%, 13%, that is very high. That means it is not only HbA1c, the blood cells are damaged, the whole body it is affected. If someone's HbA1c is 10, that means 10% of the cells, not only the blood cells. That is actually we are checking on the hemoglobin, but it represents the protein or the cellular protein which is damaged because of the glycosylation. That is excess glucose, that it will denature the protein. So that much of the cells or that much damage is there. So it is always better minimum damage. So always better you can keep, if your HbA1c level is around 5%, that is always better. Next, if you have already diabetes, you have understand that you have hyperinsulinemia, or you are pre-diabetic or diabetic, then you have to check the other organs. What are the damages which has happened to other organs? For that, you should look for a lipid profile that will show how much fat is accumulating in your blood, and also liver function test, kidney, how much kidney is affected, kidney function test. Then inflammatory markers. Many of the diabetic patients, the inflammatory markers, even the blood count, ESR, and even many will be having polycythemia, that is actually excess amount of RBCs. The RBCs are damaging, so the body will be making excess amount of RBCs. That is called polycythemia rubra vera. That is the medical diagnosis. That is basically the hemoglobin level will be high, but usually 14 or 15, 13 to 15 or 16 will be okay. But they will be having a 17, 18 and all. And what is the danger in that? The blood will be more viscous, and the chance of getting clots in the blood vessels and getting a heart attack or stroke will be higher in those patients with a high level of hemoglobin. So next is diabetic patients are prone for autoimmune diseases. The most common nowadays is the thyroid, Hashimoto's thyroiditis, and also the other arthritis, and many will be having some muscle pain, joint pain. Almost if the diabetes has started for 5 or 10 years, most will be having some joint problems also. That's also a sign of autoimmune disease. You can check for the markers of autoimmune disease like antimicrobial antibody and for TPO, anti-TG. That is depends on all the organs, and you can decide which all and autoimmune panel you want to test. It depends on the symptoms. And also the diabetic patients are prone for cancer also. So we should check for the cancer markers. That also easily you can check in the blood whether any cancer marker is positive. Most of the diabetic patients are middle age or in the going in the 40s, 60s and all. So there is a chance of otherwise also the cancer will be high. So check for the cancer markers like PSA in male, CA125 in female, and the CA, that the colon cancer is so common. And so many other cancer markers are there. Depends on other health problems of the patient. We can select which are cancer markers also to be checked. Next, what are the other diseases which can be accompanying with the diabetes? So usually the patients who is diabetic will be already obese, or when they start with the diabetic medicine, they will start gaining again weight. That is because of that medication. It is most of the diabetic medicines, not all, most will be increasing the insulin level. So it will hypoglycemia and hyperglycemia. It will be alternating hyperglycemia and hypoglycemia, and also high insulin levels. This will increase the appetite, and the chance of getting more weight gain will be high. So the metabolic syndrome, that is actually even this hypertension, dyslipidemia, and obesity and diabetes. This is actually the primary accompaniance of the metabolic syndrome. Initially, if there is only diabetes also, there will be others will be coming soon. That is what we are usually seeing. Most of the patients will be knowing. They might get either obesity, usually obesity first, or at least abdominal obesity, protruding tummy, then diabetes, or dyslipidemia starts, then diabetes, and then along with that hypertension also. So then again it will other diseases comes, heart disease, kidney, retinopathy, eye problem, hearing loss, fatty. Initially there will be only fatty liver, then it goes to fibrosis, or even liver failure, and the kidney most commonly affected. There also we usually give importance only at the end stage of the CKD, that is chronic renal failure, only for fourth or fifth level only the patient actually recognizes it. Even only with the renal function test, we should check the GFR. If the GFR is going down below 90, you should not wait for the fifth phase to come to take care of the kidney. So we should check the renal function test, especially GFR, glomerular filtration rate. And for the heart, we should check definitely lipid profile is very important. Triglyceride, more than cholesterol, triglyceride. If the triglyceride is high, you are under risk. And also you can check for the what is the possibility of heart attack through the troponin test. There is some cardiac markers are there, and also HSCRP, CRP. Those things also give even the plaque test. That is how much the atherosclerosis is affecting. So these things will give an insight into what is the problems when before the disease itself or the symptoms comes. You will be able to understand what are the damages happen to the blood vessels and to the organs actually. Another major problem is the diabetic patients is the neuropathy. Actually, the peripheries, the hands and the feet, that is glove and sock, is neuropathy actually. So actually the neuropathy means the nerves are getting damaged. Actually in diabetes, what is happening? Because of this high glucose, it is damaging the blood vessels. That is the primary thing. The whole blood is actually, the whole glucose is circulating in the blood, excess glucose. So it primarily affects the blood vessels. So this blood vessel damage, this vasculopathy is the reason for all the diabetic complications. So blood vessels are all over the body. So what is happening? All the organs can be affected. Diabetes can affect every organ. That is because it is affecting primarily the blood vessels. In neuropathy also, the nerves, that is the coming to the tip of the fingers and all, it is so long. It is starting from the cervical vertebra, upper vertebra, and coming to the tip of the finger. So it's traveling a long distance, and it is along with it there is blood vessels which is supplying this nerves itself, very tiny blood vessels. So they are getting damaged. So this nerves is not getting enough nutrition. So they are getting nerves are damaging. Even from the nerves going to the toes or the foot, it is also very long. It is starting from the back, around the level of the pelvis actually. So it has to travel a long time, and it is the blood vessels are along with that is getting damaged. So usually the tip, that is why the tip of the fingers and the foot and all is affected early. And also there are other long internal nerves are there actually, autonomic nerves. Among that, the vagus nerve, that also is a long one, which is starting from the brain itself directly, and it is traveling all over till the intestine, all the internal organs it is supplying. So that can also get damaged. Actually, this autonomic neuropathy is also a major problem for the diabetes. That is actually many will be having gastrointestinal problem, gas, this constipation. These all because of this enteric nerve system. Actually, enteric nerve system is there, that is also affected, and also this vagus nerve and the sympathetic chain and all the nerves can be affected, and the dizziness and many complications of the diabetes is due to, or the symptom difficulties the patient is facing is because of the autonomic nerves neuropathy. The other sensory nerves can be also affected, and many of the diabetes patients may not be able to feel the taste of the food much. They will be always complain. Many of them will be complaining of taste problems, and also hearing. We can see that many of the people using the hearing aid, they are actually either diabetic or hypertensive. That is also, both will be damaging, and there will be definitely, if you are diabetic or hypertensive, you will be dyslipidemia, that is cholesterol and triglyceride will be high. So that is also damaging the blood vessels of the nerves. That is why this hearing loss and eye problem, even for the small blood vessels in the eye problem is one of the reason is high insulin also. There is a high insulinemia, otherwise it is insulin resistant, and also we are injecting insulin, and also we are taking medicines to increase the production of insulin. So the hyperinsulinemia, it is not only the glucose which is damaging, actually the insulin also is damaging. Anything is in excess in nature is damaging. We know that even hypothyroidism is there, hyperthyroidism is there. Hypothyroidism is it easy to treat. You can give tablets for that. But hyperthyroidism, it is more difficult to treat, and usually we may need a iodine therapy, that is radiation treatment, or the surgery for a hyperthyroidism. But for the pancreas, when it is overworking, actually we are again injecting insulin. So that is the problem actually. It's a hyperinsulinemia is creating many of the problems. Even the reason for this increased cancer in the diabetic patients is hyperinsulinemia, because when the insulin is in excess, your immune system cannot work properly. And also the glucose is also giving an additional support for the cancer cell to grow. Hypertension. The reason for hypertension in diabetic patients, or when we start insulin or diabetic medicine, hypertension is increasing. One of the reasons is insulin is actually binding reduce the excretion of the sodium. So we always say that hypertension patients should not take much of the sodium, common salt. But insulin has a tendency to retain the sodium. So high hyperinsulinemia, so there is chance for hypertension also. So you will be increasing first day there will be only one tablet for the hypertension. Then after starting diabetic medicine, parallelly your hypertension medicine also will be on increase. Diabetic medicine one side increasing, parallelly the hypertension medicine also will be increasing. That is because of this. Next, a diabetic patient should know what are the treatments available. Basically, it's a lifestyle disease. Lifestyle disease, primary concern is lifestyle correction. But a person needs the treatment or any diabetic medicine is because they are not able to correct the lifestyle. Even for a type 1 diabetic patient, if it is diagnosed early, and usually the type 1 diabetes starts at a young age, no? So the starting of the diabetes, within 1.5 to 2 years, the pancreas will be knocked out. Complete beta cells will be gone. So, but if you are diagnosing at the age of 13 years, one child is diagnosed with a type 1 diabetes, and if you are seeing that situation itself, you should check the insulin level. And also, if the patient is already on insulin, check the C-peptide level. If the C-peptide level is at least 0.7 or low normal, or just even some pancreatic islet cells are working, and if you are willing for a lifestyle correction, the child cannot decide, the parent should decide. And the child, there will be a complication is that if the child problem is there, it's a lifestyle disease. When a child get a lifestyle disease, parents' lifestyle is not correct. So they should also will be willing to correct the lifestyle. If the parents are also willing to correct and the child is guided, definitely there is a chance that the disease progression can be stopped and the pancreas can be saved. But if 2 or 3 years it's already on, it's a type 1 diabetes with autoimmune antibodies are high, and it will be going into, if the lifestyle correction is not done, it will almost within 2-3 years, definitely the pancreas the C-peptide level will be come to 0.01, 0.2. That stage we won't be able to do anything. In that stage, we can give only insulin injection. So insulin injection, that is the major treatment parameter. No? For the insulin injection also you should understand that insulin nowadays we are using mainly human insulin. That's the most natural form of insulin. There are other human insulin analogs are there. That is actually some genetic or the protein variation, the amino acid sequence or the structure is slightly different. So it's always better, especially for type 1 diabetes patient, always use the most natural form of the insulin. The other insulins, these analogs, is not much advantage over the natural insulin itself is very short acting, long acting and all is there. So the other will be having only marginal advantage. There's actually, in fact, long-term study shows there's not really any advantage. Only thing, the newer things will be having more push in the market and it will be more expensive. That's all. It's always better go to if you have anyway got type 1 diabetes, your pancreas is totally gone, then you had to take insulin and stick to the natural ones. Go avoid the analogs, because it is not similar to your natural one. So there is a chance for getting autoimmune immune problems, immunity problems, and it may not, because of this autoimmune activity, it may not can create problems in you, because you are taking it long term also. Then for the type 2 patients, actually there is already enough insulin is there, and there is no need for insulin injection for the type 2 patients. So it is actually scientifically, if you are assessing the fact and this thing, it is actually unscientific to give more insulin to a person who is having enough insulin. You have to reduce your carbohydrate intake. Instead of you take more carbohydrate and you give more insulin. It is not the correct way of doing actually. You have to reduce your carbohydrate intake, and also if you are overweight, almost all the patients, even if you are not overweight, you will be having excess fat. Abdominal obesity and excess fat will be there. So you have to control your fat, the calorie intake, and reduce the intake, not push more insulin. The insulin level is already there. Insulin is also high insulin. Insulin is needed, but high insulin is one of the, it's damaging for the body. So you should avoid that taking. So you have to correct your, that is the importance of lifestyle disease, lifestyle correction. That is the answer really. But we are taking the shortcuts, and initially we were not knowing. 100 years back, when insulin was started using, it was a boon for the diabetic patients, especially for the type 1 diabetes, because there the control is there. At that time we started using the type 2. We were not knowing what is type 1, type 2 and all. But now we have the clear understanding about the type 1, type 2, and we have enough diagnostic tools to differentiate to both. So we should restrict the use of the insulin to type 1 alone, and ideally the natural ones, not the analogs actually. That can, if you can get control with that is possible. If you are controlling even type 1, taking insulin also, you should control your calorie intake, especially carbohydrate intake. And if you can arrange, even there's no need to take 4 times. If you are really understand how to manage, you can reduce the insulin intake at 2 times or like that. Another form of injection which is used commonly in diabetic patients is glucagon-like peptide 1 receptor antagonist group of medicine, that is commonly called GLP-1 receptor agonist. That is usually exenatide, dulaglutide. Everything is ending at the glutide, semaglutide. So the semaglutide is actually recently come in a tablet form also. So these are actually, it is not insulin. The patients may be thinking that also in insulin. It is working in another way. Actually, the advantage of this is many people of the patients will feel decreased appetite. So the major problem with the diabetes is more craving for the food. This will reduce the craving, and so it is actually nowadays it is using for so many other purposes like weight reduction. So to reduce the appetite, and so there is definitely a chance for reducing the weight gain. So it will indirectly benefit the diabetes actually. This major side effect is actually nausea, vomiting, all the gastrointestinal side effects is the major problem. Next, when we come to the medications, actually the initial medication was sulfonylurea group of medicine. That also, now also it is using glimepiride, glipizide and all. It is actually usually along with this, next came actually the bigonides, that is metformin. That is usually the first line of management is metformin. Usually initially the patients are given this metformin plus one of this glimepiride or those group of medicines. That was the initial, that is after the insulin and the oral medications, that was the initial ones. But now there are other medications like glucosidase, alpha glucosidase inhibitors like oglibos, that is actually delaying the gastric absorption when you are eating. Along with that, the top type of tablet is used. Your prostaglandin increase. Immediately after the sugar peaking will be reduced. That is the advantage of that. And the major discomfort or side effect is the gastric gas formation and gastric irritability, the gastrointestinal side effects that are the common side effect. For all the medicines which is taken orally, the gastrointestinal side effects will be there. Then next came the thiazolidine group, that is rosiglitazone, pioglitazone and all. The major concern was actually with the heart problems actually. Everything will be having its own side effects also. I'm not going into the details of the medications or the details of the side effects, because you should take it granted that every will be having complication, and one of the major side effects is the hypoglycemia itself. That is this glitazone group can have, and also the other glimepiride, and also is very well known for the hypoglycemia, that is the glucose level will go down. And insulin itself can, that is the most important side effect of all this diabetic medication, especially the insulin. Hypoglycemia is one of the major side effect. Another group is DPP4 inhibitors, that is vidagliptin, sitagliptin, that is gliptin group of. The patients will be knowing, we can check what is the gliptin or which group it is coming. There are so many medications. In each group there will be so many medications. And also another medication is SGLT2 inhibitors. That is actually comes in the, it has a different mode of action actually. All the others are manipulating the insulin production basically. And metformin, that is the bigonides, have some insulin sensitizer activity. This SGLT2, what it does is, that is actually dapagliflozin, empagliflozin and gliflozins, that actually try to excrete the excess glucose inside in the urine. So it will kidney will be everything will be sieved out, and it will not it actually prevent some mechanism, it prevent the reabsorption of the glucose. So the excess glucose will be excreted in the urine. So the problem with that, if you are taking every day, twice a day, 10 milligram, 5 milligram, 10 milligram, twice or thrice a day, means then you're eating so much of carbohydrate. Your urine will become sugar syrup. It will be like sugar syrup. So the organisms like any bacteria, fungus, anything can grow in that. So the chance of getting an infection is very high. So during the COVID time and all, we have seen this black fungus, white fungus, and so many dreaded infections. So it is happening especially this is exposed to your private, this genitourinary organs. The private area is exposed to this high sugar level. That is dangerous, especially for a long-term use. If sugar content is very high in the urine, that area can be fungal infection, bacterial infection, and also the urinary tract infection, and the kidney can be damaged, or otherwise also the kidney will be compromised in the diabetic patient. And then limited use of that is this sort of medicines is okay. But in fact, if you are willing for a lifestyle correction only for the initial few days till you are getting control of your food habits, only a small dose can be okay. But it's very good to control, but it can also have so many complications. We should remember that. Next is, what is the problem with the treatment of diabetic medicines? So we know that we have so many so many type of insulin, so many other medicines, but till the diabetic patient is always a diabetic patient. That is the only you are increasing the dose or increasing the number of medicines. The problem is it's a lifestyle disease. So you are not adjusting lifestyle, correcting lifestyle. You are trying to take the more medicine. Here the problem is type 2 diabetes. The problem itself is insulin resistance, high insulin. So when you are taking more medicines which is increasing insulin itself, or other medication which is increasing the insulin, you start getting BP, your BP start rising, and your blood vessels get damaged, not only from the sugar, from the insulin level also. That's why those patients who are on reasonable diabetic control and correctly managing, but even them also get this peripheral neuropathy, leg ulcers, retinopathy. Actually, this hyperinsulinemia is aggravating this retinopathy problems also. Retinal problems can be aggravated, and with the insulin, and also those medicines which is increasing the production of insulin, and also GLP-1 agonist. That also they also give can aggravate this retinopathy problem, and definitely retinopathy and nephropathy and all is in the same way it is happening. That is the reason why even if you are controlling the sugar or the blood glucose control is reasonable, really no one or 99% of the patient won't get to complete blood sugar control. They cannot bring the HbA1c to 5.5 or 5 with this sort of medicines usually, but maybe one rare medicine that is because of the specific selection and all. Otherwise, with the normal insulin and diabetic medication, you will not be able to get a pakka control with the 5.5 HbA1c and all. So this insulin level is higher, it is creating problem. And GLP-1 agonist, that is one of the major, we should consider that also. And also another, because there is so much of enthusiasm in the use of GLP-1 agonist medication for multiple purposes, especially along with obesity. We should understand one more problem. It can create pancreatitis. Diabetic patients or even the obese patients or with the hyperinsulinemia will be having some amount of pancreatitis. Pancreas function, or we should assess the amylase and lipase also. And if the amylase and lipase also, the pancreas is also already inflamed. In such cases, if you are taking this for a long time and all, acute pancreatitis can come. that is the pancreatic enzymes, that is actually digestive enzyme, no? It released into the blood and it can create a lot of problems actually. The another problem is thyroid carcinoma, cancer of the thyroid. That is some special type of cancer, that is C-cell cancer of the thyroid. There is another name is actually medullary carcinoma of the thyroid. So this also is a side effect, major side effect. Another problem is with this GLP-1 agonist is gastric problems. That is mild nausea, vomiting, and all. That can be used for your benefit also to reduce your food intake. But there are cases if you are using such medicines if you are strictly controlling your lifestyle. If you are not strictly controlling your lifestyle and you are eating, taking all this and you are eating uncontrollably, it can damage your intestine also, and gastroparesis, ileus, and such complications can also occur. Now we have seen what are the problems with the diabetes and also what is the treatment and what are the problems, the medications also. Then what is the real solution for this diabetes? So for the type 1, if you are diagnosing it before destruction of the pancreas, you may be able to correct the lifestyle and you may be able to save your pancreas. Then for the type 2 diabetes, there is no insulin deficiency, your pancreas is working, so you correct your lifestyle. It's a lifestyle disease. You change your eating habit, reduce your calorie intake, reduce the carbohydrate intake. Instead of take all the carbohydrate and all the junk food and then insulin and all the diabetic medicine, instead of that, change, correct your lifestyle, reduce the carb, reduce the fat, and definitely then what should, if you are in the early stage of diabetes, you are a pre-diabetic or only you are taking one metformin or 1 or 2 tablets only, then if you are, you may be able to see that you are reducing on the carbohydrate and other things, and see, you can check the blood sugar every day 4 times or 5 times, and now there is a continuous monitoring system, 15 days. You can see in your mobile what is the current blood level all the time. So such facilities are there. You control your diet and see what is happening with your blood sugar control. For a diabetic patient, what they can eat, low carb diet. What all things are containing low carb? Almost all the plant items is having high, very good in carb. What is major item is carb. So you can, but the less carb is there in one leafy vegetables, that is actually rich in vitamins and minerals. Next, you need protein also. The protein, vitamins and minerals and fiber you had to have. So those things you can get from the leafy vegetables and from the pulses. And if you are a non-vegetarian, you can have fish or meat or egg also. So that should be till the blood sugar is controlled, you should take this leafy vegetables and moderate amount of pulses. And if your blood sugar is very high, if you are non-vegetarian, always go for the non-veg plus leafy vegetables. And you can see the change and do some exercise also. You can see the change within hours actually. So that is the solution. You come out of the medication, not just to simply stop. The medicines are creating side effects and I'm going to stop insulin and medicine. No. You had to correct your lifestyle and along with work gradually reduce. But if you are already on multiple medications, you are having 3 or 4 medicines for the diabetes, 3 or 4 medicines for the hypertension and also the heart and also for the statins and dyslipidemia, so many problems, then you won't be able to do anything by your own. Clinical support you can take and modulate your lifestyle and come out of it. So that is possible. Actually, this is for the type 2 diabetes, you can come out of the diabetes because I have experience there. From the experience I am telling, I'm giving clinically supported lifestyle correction. Type 1, if it is completely gone, it is you have to not much to do. Only in type 1 diabetes, there will be type 2 diabetes. This insulin resistance also will be there. In that case, you may be able to help the type 1 diabetic patient with lifestyle modulation, correct lifestyle modulation, and other things to reduce the number of insulin injections, and also to come out of the insulin resistance. They can reduce the number of insulin and the dose also. That is possible. But we cannot reverse the already established type 1 diabetes, we cannot reverse. But type 2 diabetes, definitely reverse. Only thing whether the patient is ready or not, or the patient is willing for a lifestyle modulation or not. And you can see the result within hours itself. So that is the beauty of lifestyle correction for the diabetic patients, the immediate result, and it is rewarding for the patient also will get encouraged. So that is what my experience actually. In brief, first, the diabetic patient should understand that type 2 diabetes is a lifestyle disease, and the first step in treatment is correcting lifestyle. When the patient fails to correcting lifestyle, medicines are prescribed to control blood sugar. Second, the type 2 diabetes that develop in adult and in pregnant women is not because of a shortage of insulin. In fact, in most patients, there is an increase in insulin level. Medication and insulin injections in the attempt to control glucose levels further increase insulin levels in the body. This is not scientific. Third, if diabetic control depends on medicine, they will have to be taken daily for the rest of one's life. Additionally, there is the possibility of increasing fat deposits and obesity. Fourth, with the increase of fat deposits in the body, there will be the need to increase medications for sugar control and also medicines for hypertension, cardiovascular disease, etc. will be needed. Fifth, every diabetic patient should ask oneself if he or she wants to take medicines daily and continue as a diabetic patient for the rest of one's life, or would like to overcome diabetes by correcting lifestyle. Sixth, those taking medications for diabetes and associated diseases usually find it difficult to correct their lifestyle to overcome both disease as well as the associated medicines. Such patients can try to correct their lifestyle with the clinical support to overcome diabetes, associated diseases, and the need for medications. This information should assist you to understand and prevent lifestyle diseases, to help detect them at the earliest when present, and correct the lifestyle to reverse them. Also, it can be understood why medication and surgery cannot reverse such disease conditions. It is not the lack of medication or surgery that create the disease in the first place. This is why it is essential to understand how suitable lifestyle changes can only reverse these diseases and, more importantly, prevent their recurrence. Before any invasive interventions or surgery, it is essential to understand the underlying cause of the disease. What purpose does the surgery serve? The on-table and post-operative risks associated with the surgery, associated possible negative impact on future quality of life. This has to be understood not only by the patient but also the associated stakeholders, who are usually those who need to support the patient and share the consequences as well. Very often, there is poor understanding on whether the surgery provides recovery or relief and whether the surgery prevents recurrence. Nowadays, health insurance is very common. This provides an opportunity to undergo surgeries without fear of any financial stress. This consumerist outlook guides many to be opportunistic and take advantage of the surgical options available primarily on the financial availability angle rather than on an overall picture. This is where the statistics that often provide us the huge percentage of unnecessary surgeries done on unknowing patients deserves maximum attention. Before every surgical intervention, the patient or guardian actually signs the document acknowledging the possibility of undesired consequences or even death from the intervention. This document of acceptance is to be read and understood before fixing a date for any surgical intervention. One should understand that any surgery is constrained by chronic lifestyle diseases, and if the advantage of reversing them with lifestyle modulation before deciding on need for surgical intervention is considered carefully, it will be possible to avoid the need for a majority of surgical interventions. We need to be proactive in health and not wait for the disease conditions to reach a stage where we lose hope of the ability to actively reverse our health problems with self-motivated lifestyle correction. Otherwise, we will have to remain an outside observer in the effort to recover health. Very often, never getting a clue of what the numerous healthcare partners are actually doing for your health. Very often, the core of improving body composition, metabolism, and immunity are never possible when you remain an outside observer, and this is what I hope will be the game changer for those who want health over conventional patient care. Another important aspect is when someone is talking about healthcare and newer treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kottayam as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Lifecarecentre, Thevara, Kochi. I focus on lifestyle modulation with the clinical support, minimizing medication and surgical interventions for lifestyle diseases. The focus was on understanding the effects of modern pharmaceutical drugs, surgical interventions, and physiotherapy on immunity. Based on the knowledge on the functioning of the immune system, developed nutrient formulas and body conditioning protocol named Oxyflex for optimizing circulation, stabilizing neuronal, hormonal, and immune activities. Optimized nutrition, along with the Oxyflex, is the foundation of the cell activation protocol, a clinically supported and supervised lifestyle modulation method for optimizing health, delay aging process, prevention and reversal of lifestyle diseases like diabetes, hypertension, heart disease, allergy, asthma, cancer, autoimmune diseases like thyroiditis, arthritis, psoriasis, etc., thereby reducing the need for medication and surgical intervention. Next, let us understand what is clinically supported and supervised lifestyle correction. Step 1 in this approach is to understand body composition and fatty tissue status to help determine desired body composition. Step 2 is to conduct laboratory tests to evaluate the health status of the organs of the body like heart, liver, kidney, pancreas, etc. Status of the system like circulatory, immunity, endocrine, metabolic, etc. and the compatibility status of food consumed or generally available. Step 3 is to identify what lifestyle modulations can help achieve the desired body composition. Patient-specific conditions will help decide on the effort at optimizing nutrition, physical activity, and the prevention of toxin accumulation. The focus is to create an enabling environment for the cells of the body to regain and retain optimum metabolic activities. When lifestyle modulations restores and retain optimized circulation, metabolic activities, hormone balance, immunity and body composition, most lifestyle disorders can be overcome. When those who have been on medication for a long time and who have not reached the stage of irreversible organ failure are ready to modulate lifestyle to benefit from nutrition and help the repair and replacement of sick cells, protection from exposure to toxins, improved circulation through controlled physical activity, it is possible to prevent or overcome the vast majority of lifestyle diseases like diabetes, hypertension, angina, cardiovascular disease, allergies, asthma, arthritis, autoimmune diseases, cancer, etc. This also helps to avoid the need for medication and surgeries. Next, we will see how we can come out of diabetes with the clinically supported lifestyle correction and what are the benefits actually got for the patient. I'll give you an example. This is a 26-year-old young man. His height is 175 centimeters and he's 86 kg. He is diagnosed with the diabetes for the last 8 years. That is, at the age of 18, he is diagnosed with the diabetes and he is on insulin from that day onwards. Now he is having hypertension also. He is not yet started antihypertension for medication for the hypertension. And his problem is, symptomatically, is having swelling of the palm and foot. Already peripheral neuropathy has started. And with the increased sweating also is there. And pain of the this glove and socks sort of neuropathy. And he is having another problem is allergic also. And dyslipidemia, that is high cholesterol is there. And he's when he's look into his old histories, he has actually undergone liposuction for the gynecomastia, young man. So this increased breast size, and he has gone for his corrective surgery, this liposuction, that is fat is sucked out. And his family history, his father was diabetic and he died of cancer also. So only mother and the child, the son is there actually. So the mother is so worried because only one son and the father has had diabetes and that son also is having diabetes from the 18 years onwards. And he is taking insulin aspart 3 times, 40, 10 and 8, and also Lantus 30 units at night also. That is long acting. The other is with the food. That is the usual pattern. Diabetic patients may be knowing that. 3 times and then one long acting for insulin injection. And he was considered as a type 1 diabetic patient actually. But when we look into the details, when the test, actually his insulin level was high. 65, 66 was there. Actually, maximum level is actually 25 or so. But his C-peptide also is normal, 1.89. So it's only type 2 diabetes. That is another problem. Many patients is thinking that they are type 1 diabetic, especially those who started with insulin at a young age. I had seen patients who started with 15 years, 16 years, and they are thinking that it is type 1 diabetes and they are going on. But it is only a type 2 diabetes. It's actually maturity onset diabetes of the young. That is the one type that is called MODY actually. That is, in the medical terms, it is MODY type of diabetes. That is type 1 diabetes of the young. And in that is usually happens in the patient's family member will be having a diabetic. His father was a diabetic. That's why there is some problem with the pancreas also. So there's only pancreas is not able to produce so much of insulin. Here it's a hyperinsulinemia because not the pancreas is producing, but pancreas is producing enough insulin. That is shown by the C-peptide. But this hyperinsulinemia is because of the insulin injections actually. That itself, it is not, he's taking aspart and insulin glargine. It is not a natural insulin also. It is actually this analog. So he's taking for a long time. Now he's only 26 years. Definitely there is high chance for developing insulin resistance also because of this artificial form of the insulin. Then other blood parameters also quite abnormal. He is having a very high cholesterol and triglyceride level is 327, and his HSCRP and CRP and all is high. Microalbumin, kidney is already affected. Microalbumin is there in the urine. And liver function also some high protein and albumin and all is there. So that is very common with the diabetic patients, kidney and liver and the blood vessels. He's already, this HSCRP is a cardiac marker. His father has already died because of the cancer itself. Another thing is other inflammatory markers also is high. These things are inflammatory diseases, and he is at this young age itself, HSCRP, the cardiac marker, and the CRP without any infection and any fever and all, that also is high. That means the chance for family history is there. So he's getting a heart attack or a cancer also will be very high. So what was the treatment then? Now come to that. For a patient who is having type 2 diabetes, because it is proved, even though he's thinking that, or the family was thinking it's type 1, it was only type 2 diabetes. And we stopped the diabetic medications, all the insulin injections we stopped. And you can check the insulin at home itself. And you can see the insulin without special food is there, low carbohydrate diet. You usually ask the patients to record it 4 times a day, and they can see that the insulin level is coming down. Usually within 24 hours, blood sugar will come down to normal, provided the patient is taking, following the instruction correctly. But if they take some high carb diet in between, definitely it may shoot up. So for that also we'll give usually stricter special food is there, and also they can take leafy vegetables and till the blood sugar control is controlled. They can take non-vegetarian items also. Once the blood sugar is controlled, they can have these pulses also, and controlled amount of fruits and vegetables. It depends on each patient actually, and also their activity level. And the surprising thing is, by the day 120, his HbA1c is only 4.8, and his insulin level is 6, and C-peptide also is normal. So complete cure. There is no complication, no problem at all. And his initial weight was actually 86 kg, and by 120 day he came down to 68 also. That is also the reflecting the body change also. Actually, when he came, he is only 26 years, but his body age was 47. So almost 21 years accelerated aging was there. So actually, by the end of the treatment, actually he came down to his body composition, everything is got corrected, and his body age came down to 23 actually, and weight down from 86 to 68, and his body age came down from 47 to, he's really 26 and 3 years younger than that, to 23 is the ideal. This is what we can expect is an ideal result actually. What else we can expect from a reversal? So if he continue like this, and he can manage without, you don't have to think of diabetes. Only thing, he should not increase his weight, and he has to follow the low calorie diet. Low calorie means he can take the food as according to his activities and control it, blood sugar control. And now it is only HbA1c is below 5, so that is ideal for him because he is having a family history of cancer. So it's always better to keep the HbA1c level. If you are a cancer patient, or if you want to avoid cancer in the family running, you need not worry about the cancer at all. If provided the other parameters, you should avoid the junk food and the toxins. Everything should be also considered, but keep the HbA1c level below 5. That is the more that we always tell the patients with the cancer to make their HbA1c level below 5 is one of our target actually for the cancer patients. Another patient, this is also a young man, he's 40 years and his height is 176 centimeters and weight is 70 kg. He's not overweight or anything. He's diabetic for the last 10 years and hypertension for 1 year. Now his problem is cardiac pain. He's feeling some sort of angina sort of pain in between on the heart, and he was consulted cardiologist and advised to have angiogram. And he's on multiple medications, not only for the diabetes, he's taking Diplat, that is aspirin and clopidogrel, metoprolol for the BP, atorvastatin 40 milligram, ramipril, that is also for BP, and glibenclamide and metformin. He's not on so many medicines are there, and his major worry is cardiac problem, heart attack he's worried. And his father is also diabetic and also heart problem is there. He has had a bypass surgery also. His investigation HbA1c is 8.5, not that high, but triglyceride is very high, 381. And his liver function also, fatty liver is there, and also liver enzymes also high. So his kidney function is okay. So liver is affected, and also blood vessels and the heart is affected. So in this patient, actually it was he was also very good patient, and he's got the we stopped the diabetic medicines in first day itself, but the other cardiac medicines will be continuing initially. So we stopped the diabetic medicines completely in the first day when starting itself. All the other medicines, that BP medicine and the other blood thinners and all, we gradually reduce according to the BP reading, and also for the cholesterol and other cardiac parameters like HSCRP, and when all those things are getting corrected, we gradually withdraw. Actually, when starting his HbA1c was 8.5, and in the if he ate the day itself, it came down to 7.8, and in the 15th day it came down to 7.1, and 30th day 6.5, 60th day 5.9, and by day 90 it was 5.6. By day 30 his hypertension medicine is also over. The blood thinners not stopped completely by the 30 days, but by day 60 the cardiac medicines is also over. So day 90 also nothing. He is completely clear, and his chest pain and chest discomfort is also gone. That is by the 15th day itself he is almost clear, but he's saying some slight pain and all things. But by the 60th day, he has no complaint at all. And all his blood parameters is normal, no medication. Let us go see the details of another patient. This is a lady, she is 43 years, her height is 165 centimeters and weight is 64 kg. She is diabetic for the last 17 years. That means she got diabetes by age 24. And she is taking medication for cholesterol also, and she's on medication, but her HbA1c is 13.1, so it is not at all controlled, and she's having some renal stone and recurrent urinary infection also, so it is very common for the ladies. The importance of this patient's particularity is her C-peptide level also was low. Only 0.8 was there, and insulin also low normal. It's only 4, and C-peptide. So I was suspecting that whether she is going into type 1 also. And she is not on a diabetic insulin, so there is a chance that it can be revived. That is the positive thing when we see the initial report, but I will tell the patient if the C-peptide level is there low, we may have to, but if the C-peptide level is low and there is no meaning in taking tablets, only insulin. If the type 1 diabetes means it is only insulin, but usually if the 0.8 and all is there for the C-peptide, we will be able to revive the pancreas. That is my experience. And she is also having, even with the cholesterol medicine, statins, her cholesterol was high, 263, and triglyceride 296. And she was having some anemia and all. We are not going into the details. Next, what was the result actually? So we stopped the diabetes medicine in first day itself. And the cholesterol medicine, I think we were able to stop within a month. By 30 days, she was not taking any medicine. But her, with the medication, her HbA1c was 13 actually starting. But by day 120, her HbA1c has come down to 6.1. Then what was the result for this patient? And who was diabetic from the 24 years, it is for the last 17 years diabetic. And she was able to bring down her HbA1c from 13.1 with medicines to 6.1 without medicine within 120 days. 122 days actually, we are rechecking. In between, I am not going into the details of the gradual reduction and all. And also, she was not that overweight or anything, but she came down, she was 64 kg, and she's tall, 165 centimeter, but she came down to 57 kg also. Some fat, the abdominal fat was there, so that was also good. And she's, I think, what I'm expecting is to bring her weight to around between 50 and 55 and keep her HbA1c 5.5. Next, we will see a patient who's having more complications, who was facing so many complications with diabetes. She's 75 years. She's diabetic for the last 29 years and hypertension 1 year, and thyroid problem is there. and thyroid, she's taking medication, and renal problem, CKD, renal failure is there. She had undergone bypass surgery already, and she's having edema leg that we had to take it as a sign of, and even cardiac failure. And his kidney is affected, heart is affected, varicose veins is there, and she's having hemorrhages on the hands also. That is actually those who are taking this clopidogrel and antiplatelet medications can get some petechial hemorrhage. That is because of the blood is not clotting also. And she had CA breast. See, diabetic patient, chance for her cancer is high. And she, in 2012, she had a CA breast and left breast is removed. And she's having tension, muscle cramps, so many problems. And she's on so many medicines also, almost 15 type of 15 medicine, maybe more than that, 15. Actually, she's taking 16 type of medicine, 14 tablets and 2 injections daily. So the medicines, I'm not going to read the list of medicines, so many are there actually. So it will take a lot of time. The diabetic medicine itself, actually, she is taking 2 times injection, and dapagliflozin twice a day, 10 milligram, tenagliptin once a day, then another bilipsa, seroglitazole. So it's almost 4 tablets and so many hypertension medicine, 3-4 medication for hypertension and heart, so many problems. And her even kidney was affected. So her GFR is only 40. And insulin is high and the C-peptide is okay, 2.86 C-peptide, and insulin is 35 is there. So that is with insulin and all. So this, and also her liver also, liver enzymes is high, fatty liver is there. That is always with the diabetic patients it will be there. And HSCRP also high, that is another cardiac marker. And amylase and lipase also is, that is commonly, many patients we see that pancreatitis also, she is also having amylase and lipase is also high. And then what was the result? I'm not going into too much of detail, but initially for the first day she was taking 16 medicine. By the 8th day when she started, 16 medicines and 2 injections. By 8th day she was having only 9 medicines and only 6 tablets, 9 medicines but 6 tablets. And by 15th day, only 6 tablets, 6 times medicine she is taking. By 30th day, only 4 tablets are there. By 60th day, only 1 dose medicine. That is actually this this cardiac medicines is gradually only stopped. By 90 days, no medication at all. Even the petechial hemorrhages, that is the hemorrhages, the blue spots were there on the hand, it was all disappeared actually. Then what about the diabetic part? She was having, her insulin level was 7.6 on the first day, and it came down to 6.9 on the 8th day itself. I was surprised actually. Usually this much reduction is not that easy for this age 75-year-old person. Youngsters, it is fast reduction is possible, but she's also came down that fast. And by the 15th day 6.6 and the 30th day 5.8, and by 60th day it is 5.2. And 90th day also she is maintaining it 5.3. It's slightly that change, but it is in the normal range. And the most importantly, her renal function was gone down, and the microalbumin was very high, and also the GFR was low, 40. And it is by the 8th day itself, the GFR increased to 47 and microalbuminuria reduced from 1867 to 950. So see the difference. Within 8 days, this much change is there for the kidney also. Kidney is also reviving. And by the 30th day, GFR came up to 55, and by day 60, GFR 60, and day 90, GFR 66. See the difference. See, that is even the damage to the heart and the blood vessels, kidney, all can be, in a way, it can be also, some extent it is reversible. So that is the happy thing about this lifestyle modulation itself. So this sort of patients definitely need clinical support also. Otherwise there will not be. They need the clinical support, means they need, when they control the food, they need all the nutrient in their correct proportion. And this omega-3 and all is very important. Omega-3 ratio, omega-3 and 6 ratio is very important because it has a major role in insulin resistance also. So everything is in the correct way. And also this 75-year-old lady also has to do some exercise. It will be very difficult for, they can go for a walk outside and all, because there is a chance of fall and all. So special exercise which is done in the lying down position itself or in the sitting position, and along with that and ensuring all the nutrient, that is giving this wonderful result actually. Let me say one more example. This is a 67-year-old man, 172 centimeters and 65 kg. It's not overweight or anything. He's having diabetes for the last 33 years and hypertension for 10 years. And he's taking medication for the epilepsy also for the last 20 years. And he is also having some renal function also. His GFR also, this creatinine also started rising. That is actually his one of his major concern. And he had a renal stone also, some allergy problem, nasal block. And definitely on this age he had, when we are investigating, there is fatty liver is there, BPH, prostatic hyperplasia is there. And so I'm not going into all the detail of this patient, because at this age there will be so many problems. The beautiful thing about this lifestyle modulation is that if you are getting corrected from all these problems in the parallelly actually. You don't, for when you are taking medications, you have to take medicine for the diabetes, hypertension, heart, epilepsy, and everything. So, but in this, with the clinically supported lifestyle correction, you can come out of all the things in the same sitting or the same course itself actually. And he's also was taking almost 11 medicines, including insulin Landex. It is natural insulin only. And diabetes galvus, that is vidagliptin, metformin, and then this BP medicine, 3 hydrochlorothiazide, amlodipine, bisoprolol, telmisartan, 4 BP medicines, and also atorvastatin and clopidogrel, and also levigress, that is for the epilepsy also. So for this patient, his result, we should, here also we stop for all the patients, this is also his C-peptide level was 3 and insulin level was high actually, 46. And his HbA1c is 7.9 initially. By 30th day, the HbA1c was 6.8 and 60th day 6. And by 90th day, it is 5.8. See that without medicine from 7.9 to by 90 days, it is come down to normal. So that is the advantage. Actually, he was taking 13 medicines every day, and by 8th day itself it has come down to 6, and then 15th day it has come down to 4, 30th day 3, and by 60th day it is 0 actually. Even the epilepsy medicine, he was telling that he is getting some discomfort, this epilepsy, even he takes the medicine also. But he can tell that he is a very wise man actually. And he can tell that he knows that if he don't get enough sleep, he'll get some premonitory symptoms. That is, almost all the epilepsy patients know that some symptoms will come in the brain, headache or something like that. He knows that there is a possibility to get. So what he has done is, he stopped the medicine, but if his lack of sleep, some problem comes, only she needs to take that. And if he is having some epilepsy feeling, then he should avoid completely the glucose. See, actually this epilepsy and glucose also have some connection. This keto diet, you might have heard about the keto diet for weight reduction and so many things. Actually, keto diet is actually low carb diet. So the ketone bodies, that is the fat, is used as a energy part. Even in the brain, high quantity of the glucose is a stimulant for the epileptic thing. So it is always better. This keto diet is developed for the epileptic patients in the 1980s and the end of the 80s and all, because at that time there was no medication. So the starving and keto diet and all was the treatment actually. So this patient actually, when the diabetes, even for the epileptic patients, the control of glucose is that much important. So what I had given advice that if he is having any sleep deprivation or anything, he should, as a preventive, he has to take the diabetic this epilepsy medicine. And also in that circumstance he should take especially give special drink also with a sodium potassium ratio 1:3. So for the correct brain and nerve functioning, the sodium and potassium ratio should be around 1:3 or 1:4. So drink that drink, special drink, and avoid this glucose and other things, and take rest and try to go to sleep. That is, if he can do that, this epilepsy will not occur. And also as a prophylactic, take one tablet also. So he is able to come out of epilepsy also. That is the happiness in this patient. And he was taking it for the last so many years. Even for the epilepsy, he was continuously taking 20 years. But even in between also, he is getting an attack. But after, actually, he has come for the last 1 year, he has come for the 1 year checkup also. Till that he had no problem. Once or 3 or 4 times he took the tablet, that's all. The focus of clinically supervised lifestyle modulation is not on the symptoms. Focus is on the lifestyle parameters to be corrected to set right, the undesired variations in the body composition, hormone activity, circulation, immune status, etc., which are at the root of one or more lifestyle diseases. This explains why patient can simultaneously get relief from multiple diseases, multiple symptoms, and multiple discomforts. We should understand that the basis of recovery from diseases is the self-healing power of the immune system. The goal is to create the optimal environment for the immune system to stimulate this self-healing power. Everyone should try to self-modulate their lifestyle to optimize health. When this is not possible, or when suffering from a serious condition, or when suffering from multiple disorders, or taking chronic medication, or suffering from the ill effects of chronic medications, or when the surgery is under consideration, the need for clinically supported and supervised lifestyle modulation becomes necessary. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, the treatments with the emphasis on the benefits of lifestyle correction from the website and YouTube playlist. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding the symptoms, current diagnostic methods, and treatments along with the benefits and side effects. Practical aspect of the lifestyle self-correction, and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. Thank you.